Okay. Okay, the Committee on Finance will come to order for our Tuesday agenda, April 4th. And first up is Senate Bill 239 SD2 HD1 relating to early learning accreditation. First up is Executive Office on Early Learning.
We must have other things to do. Sorry, leaving.
Aloha Chair, Vice Chair, and members of the committee. I am Jordana Ferrer with the Executive Office on Early Learning. We stand on our written testimony in support and defer to the Department of Human Services. Thank you.
Thank you. Okay, next is Hawaii Association of Independent Schools.
Aloha Chair, Vice Chair, members of the committee. My name is Phil Bossert. I'm Executive Director of the Hawaii Association of Independent Schools. We're strongly in favor of this bill, and just want to highlight that of the 114 private schools, 59 of them have preschools, and none of those preschools receive any state funding, and the majority of them are accredited by us. And so this bill, as it's currently stands, would allow those schools not to have to go through additional accreditation by a mainland organization. Thank you very much.
Okay, thank you. Okay, next we have Hawaii Children's Action Network Speaks. I think. Oh, come on.
Aloha Chair, Vice Chair, members of the committee. Tue Apr with the Hawaii Children's Action Network speaks. You have our testimony in support of this bill. We are asking for one amendment and here to answer any questions. Mahalo.
Okay, thank you. Next, Office of Wellness and Resilience, Office of the Governor. On Zoom? Oh, wrong bill. I went too far. Okay. All right. Okay. Oh, you're going to speak. Okay.
I'm Erica Yamauchi with the Office of Wellness and Resilience, standing in for Director Hartsock. We stand on our written testimony and are here for any questions.
Okay, thank you very much. Okay, is there anyone else wishing to testify on this measure? Please come forward.
Good afternoon, Chair, Vice Chair, and members. I'm Scott Morishige, Administrator for the Benefit, Employment, and Support Services Division. On behalf of the Department of Human Services and our Director, Kathy Betts, we did submit a written testimony. I'm not sure if you received it, so I apologize.
Yeah, we have it.
Okay.
Thank you.
So the department supports the intent of this measure. We offer comments, request clarification, and suggest some clarifying amendments. We also provide in our testimony some estimates of accreditation, technical assistance, and accreditation fees, and the funding necessary for one full-time equivalent to develop and administer the accreditation program. I'll stand on our written testimony, and we know also that if this measure proceeds, we request an extended effective date to allow time to develop administrative rules and procedures and to make the necessary system modifications. Thank you.
Okay, thank you. Is there anyone else wishing to testify? Okay, members, questions? Okay, seeing none, we're going to move on. Nope. No, Representative Kobayashi, please.
For Office of Early Learning, Department of Human Services talks about making the accreditation voluntary until the child, the workforce is more stabilized or subsidized. How long would that take? It sounds like this is a series of delays. Oh, did Office of Early Learning disappear?
Disappeared, reappeared.
I believe that's in the testimony of Department of Human Services.
Yeah.
So the question is about when will the field be stabilized?
Well, I mean, it looks like several people are asking that there be delays in the accreditation process because it takes time, et cetera.
Mm-hmm.
So what kind of time are we looking at?
Does DHS want to respond to that? The accreditation expectation falls under, well, providers can choose to become accredited, right, if they're licensed under the DHS, and we don't have, EOEL doesn't have purview over licensing, so I'm not entirely sure I'm not sure what the question is. Understanding that it was a testimony of DHS that had indicated that.
Scott, do you know?
So, thank you, Representative, for the question. So, right now, our concern, as we mentioned in our testimony, is the impact on the childcare workforce. They have very limited staffing capacity, and they would need additional capacity to be able to support the needs for accreditation. We cannot give an exact date because this is something that we would have to regularly monitor. But we are concerned that there's not the necessary workforce to be able to really meet the accreditation needs to bring all the providers up so they are able to get accredited even with the assistance provided.
I mean, we need some guidance, I think, as to when the accreditation should start. I mean, on the one hand, we don't want to have, shall we say, unaccredited providers. On the other hand, obviously, they can't get accreditation instantaneously. So how do you find that balance?
So, as we mentioned in our testimony, I think we're also working with the 3 accreditation bodies to better assess, the costs necessary to bring providers up to speed. So for that reason, I think we would need additional time. Like I said, the impact of the pandemic on the workforce was very significant, and it's difficult, again, to give a very exact time frame when the workforce would stabilize. And again, this is something that we would just have to periodically monitor. So I apologize, I can't give you an exact time frame.
So should we just leave the bill as is and accept that some schools will be unaccredited for an unknown length of time?
So again, what we're suggesting in our testimony is that you basically would not implement the timeframes in recognition of the impact that the pandemic's had on the workforce, Representative.
Okay, thank you.
Thank you.
Okay, thank you, Representative Ward.
Chair, could I, Mr. Moshe, what's the difference between a licensed and registered childcare program versus the accredited ones?
Representative, I think I'll call on my child care regulation program administrator to answer
I'm trying
your
to figure out
question.
how many are out there that are accredited, and then how many do you need? It looks like a supply and demand issue that we're getting stuck on.
So the difference between a licensed provider and an accredited provider is a licensed provider meets the basic minimum health and safety requirements that the Department of Human Services established. If an accredited provider goes beyond that and meets like quality standards.
How many of those do you have now, and how many do you need?
So there are 220 licensed providers that are not accredited.
How many accredited do you have then?
Sorry. Sorry, it's here. Sorry,
Do you have ballpark figures?
I want to
mean,
say about in the 200 range.
200 range. And how many do you need to get the program that Lieutenant Governor is going to work with?
So if you want to be a preschool open doors program provider, how the language is you have to be an accredited provider.
True, but how many do you project when the program gets off the ground you're going to need? If you got 220 now, is that enough to fill the needs?
It's a 5-year average.
Or that doesn't make any sense?
No, it does. We'd have to
Because it sounds like
do
you want to
some
get
research.
accreditation moving and off the ground, but then I'm trying to say, what's the goal of how many do you got to reach by when? When do these need to be ready to go?
So we are requesting that language that it gets deferred, I believe to 2029.
Oh, I see. Did you say defer?
No, the time frame gets delayed.
Oh, I
Sorry,
see.
delayed to allow providers to be able to, if they allow providers to be able to meet those accreditation standards. But our language in our proposed testimony is that providers, that it be voluntary at this time. Due to the workforce shortage. And then also we've been getting feedback from providers who are not accredited that the accreditations don't align with their philosophies or their standards. So hearing that feedback, we don't want to create any barriers to providers who don't want to be accredited, because then they would limit access to childcare through the Preschool Open Doors program.
I'll just add one point, Representative. So the 220 is the estimate of providers are not accredited. And when we have been talking to the 3 accreditation bodies, for example, the local affiliate of NAEYC, so one of our accreditation entities, they're estimating that they would only be able to, at least in the past, they've only been able to assist about 20 providers at a time with accreditation per year. So given that, and given the number of providers that are still not accredited, that's also part of our reason for asking for additional time for the accreditation.
And how many will you need, Mr. Morshiga? If you do 20 per year, that's not pretty rapid, actually. That's pretty slow. How many have you got accredited now then? Or have you got any?
So the 220 is about 75% of the total providers. So we only estimate about 25% or about 70, around 70 or a little bit over that are accredited. So, I think we're currently working with the 3 accreditation entities, as Dana was mentioning, to sort of crosswalk what the requirements are, see if there are other accreditation bodies that could meet those standards. But it's something that is, ongoing work in progress. And
Okay, it looks like you got almost 90, 70 and 20 is 90, but how many do you actually need when this program is fully operational? Or that's still to be realized? It's okay if you don't know.
We would need to figure out what
We'll
that number
get back to
would
you on
be.
that one.
Yeah.
Okay, thank you, Chair.
Okay, thank you very much. Any further questions? Okay, we're gonna move on to the next bill, Senate Bill 295, SD2, HD1, relating to the Child Welfare Services. First up is Office of Wellness and Resilience, Office of the Governor. She's walking out.
Again, I'm Erica Yamauchi with the Office of Wellness and Resilience, standing in for Director Hartsock, and we stand on our written testimony.
Okay, thank you very much. Next is the Stonewall Caucus of the Democratic Party of Hawaii.
Good afternoon, Michael Glowy Jr. on behalf of the Stonewall Caucus of the Democratic Party of Hawaii. We stand in strong support of this measure as it is inclusive, as well as to we do definitely need reform in this area, and having everybody's voice at the table is very much needed. So we thank you. We hope you move this bill forward. Mahalo.
Okay, thank you. Halikipa. On Zoom? No?
Hi, sorry. Aloha, I'm Venus Rossetti Medeiros, CEO and President of Halikipa. Aloha Chair, Vice Chair, and committee members. I would like to stand on my written testimony and reiterate the importance of this bill and how it calls out the importance for input from neighbor island Ohana with lived experiences, service providers, and community-based organizations that will require funds for the work group to hire a consultant to facilitate community gatherings and the necessary travel expenses to all islands. So I would like to request that funds be appropriated to the Office of Wellness and Resilience to support the work group. Mahalo.
Okay, thank you. Next is Catholic Charities Hawaii.
Aloha Chair, Vice Chair, and members of the committee. I'm Betty Lou Larson for Catholic Church Hawaii. We'll stand on our written testimony in support.
Okay, thank you. Hawaii Children's Actions Network speaks.
Hello again, Chair, Vice Chair, members of the committee. Hawaii Children's Action Network speaks. I'm the Director of Early Learning and Health Policy, and we stand in strong support of this measure and stand on our written testimony. Mahalo.
Okay, thank you. Epic Ohana.
Aloha, I'm Laurie Tochiki. I'm Executive Director of Epic Ohana. I have submitted written testimony, and I wanted to just emphasize Epic Ohana is the backbone organization of the Nakama Ahaloa network, and it is that network that from which Malama Ohana has emerged and was developed. And I am available, at least via Zoom, to answer any questions that you may have about the Malama Ohana working group. And thank you for your support, and we do appreciate the importance of this work, and we are deeply committed to bringing the voices across the state to make badly needed reforms and help our families and children. Thank you.
Okay, let's see. Next is Jackie Hong, individual, on Zoom. Not present. Next is Kimberly Navarro.
Aloha Chair, Vice Chair, and committee members. My name is Kimberly Navarro. I am in support of this bill. I am a Native Hawaiian mother who has navigated through the child welfare system myself. Today, I work alongside parents who are currently navigating the system. I also am a member of Nakama Ahaloa, and I have seen what happens with collaboration of different parts of the system come together to make choices in real time about what can help to support people who are navigating the system. Thank you.
Okay, thank you. Kailene Nihipale Sanchez.
Aloha Chair, Vice Chair, and committee members. My name is Kylie Nihipali Sanchez, and I am also a member of the Nakama Ahaloa Network. I am also a former child welfare services worker, as well as a child-specific resource caregiver and current adoptive parent of my 2-year-old grandniece, who is now my daughter. And I stand in strong support of this bill, especially as Venus shared with going out to the other islands. My daughter is actually my sister's biological granddaughter, and she is from Lahaina, from Maui. And being on Oahu, trying to navigate the system with family members on the other islands and other things, and as a former child welfare worker, seeing the intense need for this, the intense need for everyone to come to the table. And in my role as that resource caregiver, even having that former role and whatnot, just different things that come up in different spaces, and being able to all come together and having this actually start immediately versus later, because this is something that needs to be solved now, and for all of us to come together and work together for not only my keiki, but for all our keiki across the island. So mahalo nui for your support in SB 295. Thank you.
Thank you. Okay, is there anyone else wishing to testify on this measure? Please come forward.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Tim Hitchens, Social Services Division Assistant Administrator. I think we checked the box for written only, but I am here to stand on a written testimony in support of the measure, offering some comments deferring to the Office of Wellness and Resiliency regarding necessary resources, and requesting the one amendment to Part 1 of Chapter 92 for the meetings to be convened. Thank you very much.
Thank you. Anyone else wishing to testify? Okay, seeing none, members, questions? Okay, seeing none, we're going to move on to the next bill. Senate Bill 404 ST2 HD1 relating to the hospital sustainability program. First is AARP. Oh, I'm sorry, wrong bill. Wrong list. First is Kaiser Permanente.
Chair, Vice Chair, we'll stand on our written testimony.
Thank you. Okay, next is Queens Health Systems.
Thank you. Chair, we'll stand on our testimony in strong support of Mahalo.
Okay, Healthcare Association of Hawaii.
Good afternoon, Chair, Vice Chair, members of the committee. Hilton Rathel, representing the Healthcare Association of Hawaii. We're in strong support of this bill, which would permanently authorize the hospital sustainability program. This program brings into Hawaii meaningful amounts of federal dollars each year without the use of any state general funds. We're very appreciative of the close collaboration and communication with the MedQuest Administrator and the Department of Human Services. Thank you for the opportunity to support this bill.
Okay, thank you. Anyone else wishing to testify on this measure, please come forward.
Hi, Gina Mark Peterson, MedQuest Administrator, Department of Human Services. As you can tell, DHS submitted the box for written testimony today, but I am here. We stand on our written testimony and strong support, and I'm available for any questions. Thank you.
Okay, thank you. Anyone else wishing to testify? Okay, seeing none, members, questions. Representative Ward.
Hilton, if you're still there, when you say the federal funds, do you have a number how much money this actually brings in?
For this current year, the federal funds are, if I recall the number correctly, is approximately on the hospital side $120 million.
120 million.
Of federal funds without any state funds involved.
And what percentage of that would be of the total amounts for the system itself? 120 million out of.
Sorry, I don't have the denominator.
It's pretty big, though.
It's a big number.
So this is significant to maintain those federal funds.
This is an incredibly important program. It's designed by CMS and it exists in most states across the nation. And what it's designed to do is to allow hospitals to tax themselves so that they can draw down federal funds to help close the gap between Medicaid and Medicare reimbursement. And this program every year brings in material additional funds into the state of Hawaii.
So it's music to the ears of a finance committee.
Sorry?
That's music to the ears of a finance committee.
Well, we certainly hope so. Thank you.
Yes, thank you. Thank you, Chair.
Okay, thank you. Anyone else wishing to testify on this measure? Okay, sorry, this is question time. Any further questions? Okay, moving on to the next bill, Senate Bill 397 SD2 HD1 relating to professional Medicaid services. First up is ARP. ARP.
Aloha Chair Yamashita and members. Just really want to stand on our testimony in strong support of this particular legislation. We believe it's important that the professionals who provide services to Kupuna, long-term care services and others, are provided adequate support for compensation for their staff, and we believe this goes a long way in helping address that. Thank you.
Okay, thank you. Next is Hawaii Provider Shortage Crisis Task Force. On Zoom, not present. Okay, next is Kaiser Permanente.
Chair, we'll stand on our written testimony and support.
Okay, thank you very much. Queens Health Systems.
Chair, we'll stand on our written testimony and support.
Okay, thank you. Aloha Care.
Chair will also stand on our written testimony and support. Thank you.
Thank you. Next is Hawaii State Center for Nursing.
Hawaii State Center for Nursing stands on our written testimony and support. Thank you.
Okay, thank you. Healthcare Association of Hawaii.
Thank you, Chair, Vice Chair, members of the committee. Hilton Raithel for the Healthcare Association of Hawaii. We believe that this bill will address significant disparities in the overall health of different segments of our community that have existed for decades and across generations. This legislation, if passed, will increase funding for all professional services up to Medicare levels of reimbursement. And while the amounts are blanked out, to get to 100% of Medicare rates, it would take approximately $30 million in state funds per year to draw down approximately $43 million in federal funds for a total benefit of approximately $73 million. We believe this bill will have a material impact on our ability to recruit and retain healthcare professionals, including physicians, nurses, and behavioral health professionals. Thank you for considering this measure, and we're available for questions.
Okay, thank you. HMSA.
Aloha Chair, we stand on our written testimony and support.
Okay, thank you. Let's see. Next is Maui Orthopedic Institute. On Zoom.
Chair, Vice Chair, and members of the committee. My name is
Annie Thielen, and I'm a business owner and small private practice here on Maui called Maui Orthopedic Institute. My husband is the orthopedic surgeon here. We serve over 10,000 patients annually on Maui. Our overhead a month is $80,000 a month to run this practice. This is our choice if we do not support this bill. We either deny care to Medicaid population because we cannot afford to see them, or we move our family to the mainland, which so many doctors have before. And this is something that we talk about every day. This means over 10,000 patients on Maui would be able to be forced to find care elsewhere, contributing to the physician shortage here in Hawaii. My husband is trained at UCSF, one of the best programs. His partner, Dr. Eno, is a Stanford graduate. He was a physician with the Golden State Warriors, New York Mets. You have the very best here on Maui, and it's unfortunate that there's so many barriers to healthcare that prevent us from providing care to our patients here in Hawaii. So I strongly support this bill 397 and also Senate Bill 1035. Thank you.
Okay, thank you very much. Next is Don San.
Aloha, Chair Yamashita and Vice Chair Kitagawa and distinguished members. I stand in strong support of, stand on written support of my testimony with just one highlight. If this is a chance to increase Medicaid reimbursements, we ask humbly that this committee recognizes the intimate connection between oral health and whole body health, and that disease can travel both ways. And we also ask in the same way that we know our oral health financial systems are intimately connected to our Medicaid systems and our medical financial systems. Thank you so much for this chance to testify.
Thank you. Next is Esther Smith on Zoom.
Hello. I don't know if the video is coming through. Can you hear me?
Yes. Proceed.
All right. Thank you. I stand in strong support of this measure. I think it is an acknowledgement of how things that have been done by the legislature and the insurance companies have been ineffective up till now, as demonstrated by doctors voting with their feet and leaving the state and or retiring. This year, I looked at doing an internet popularity contest to fund basic supplies around my office. I looked at being a locums in Alaska because that would have been enough to fund my clinic. And in the end, I'm going to be working a second job filling in at a local hospital in order to pay myself. I want to just testify about physician despair, because since I testified previously, I've had a number of physicians come to me and tell me about the unending hours that they're working and how they can't make ends meet and how close they are to closing. This is a desperate situation, and so I hope you not only vote to put forward this measure, but also to fund this measure. Unlike building a hospital, when somebody gets their primary care visit on time, nobody gets to cut any ribbons. And when other expansions are made, you get to lucrative contracts that go out to developers, but you don't get those when Auntie's favorite physician, who she's seen for 15 years, doesn't close their doors. So I thank you for putting forth this measure that isn't flashy, but is vitally important. Thank you.
Okay, thank you. Next is Stuart Lerner on Zoom.
Hi, my name is Stuart Lerner. I'm a physician in Kailua. Sorry I couldn't make it down there. I'm seeing patients. Dear committee members and respective chairs, I am testifying in strong support of Senate Bill 397 to increase Medicaid reimbursement to physicians, nurse practitioners, and PAs. I am testifying for this increase because I am literally going out of business taking care of Quest patients and HMSA patients. This bill should be amended to increase the reimbursements to 150% of Medicare, or approximately double what it is now, as physicians in Hawaii are being shortchanged about $200 million total in a year for medical care. The current reimbursement rates for Medicaid will only pay for a physician or overhead expenses in an office. It will not pay for both. Rates need to double to cover both physician and NP and office staff. Payments should be retroactive for 2 years to account for the money that physicians like myself have had to pay to cover the cost of caring for Quest patients. When I started my practice in the office 12 years ago, overhead was only 50% and my Quest population was 20%. In the last 5 years, overhead has doubled and is approximately 90% now. Reimbursements from Quest and commercial plans have only increased between 7 and 10%. And because of Obamacare, my Quest population has increased almost 50% of my practice, and I now take care of many patients from Quest because other physicians have quit Quest years ago, and I'm one of the few solo practitioners doing this. Because of these conditions, we now lose money on every single Quest patient we see, every single Medicare patient we see, and even some commercial plans, especially HMSA, who reimburse 30% below other plans in Quest and commercially. Here are some real numbers, as the other physicians have said. My office alone has lost $200,000 in net revenue in each of the last 2 years. So that's $400,000 since 2020. So I had no profit, zero, the number zero in the last 2 years. And I'm losing money even though I'm working now 50 hours a week now. Dear Chairman and dear committee members, can you afford to have no salary for 2 years in a row? Excuse me, but no one can. Last year, I asked HMSA to increase the reimbursements or I would go out of business. That was the words I used. They said no. 2 months ago, I met with them again in person and I asked them again to increase reimbursements for Quest and their commercial plans or I would go out of business. They again said no. They offered me capitation, which pays less than fee-for-service and half of what their own capitation program offered 5 years ago. How can you make money with less income from 5 years ago? This is while they have increased their revenue from $3 billion to $4 billion in the last 5 years. The reimbursement schedule for physicians in general must be taken out of the insurer's hands. HMSA is not going out of business. Physicians are going out of business. Separately, the big picture that no one is talking about is that Quest reimbursement rates affect more than Quest patients. I have been in practice in Hawaii over 30 years, and I now take care of thousands of local residents in the community, including commercial patients and their families in Hawaii. I take care of government workers, I take care of union members, teachers, firefighters, laborers, and people in this room that are in front of you. I provide medical care to people, sometimes 3 generations at this point. You and your family's right and ability to have an experienced physician care for you is in immediate jeopardy because of the low Quest rates. If I go out of business, and I am on the verge of doing just that, as are many other small practice physicians, excellent care in the community will cease if this occurs. This needs to be changed immediately, as you will lose the most needed and experienced physicians. Chairman, who do you want taking care of you? A PA with only urgent care experience or a physician with 30 years of experience in ER urgent care and family practice? That will be the choice soon. Increasing the level of the Medicaid reimbursement 20% will not even make a dent in our ability to run an office, and an amendment to this bill needs to be made to double the reimbursement so we are at 150 to 200% of Medicare. Remember, Medicare rates in Hawaii are already about 1/3 of the mainland, so we are already at a disadvantage. So let's decouple the Medicare and double the rates. The actual cost of a visit in an office today is about $170. And for Medicaid patients, it's actually more if you account in all the referrals and prescriptions and complexity that is needed. The reimbursement is only about $90 per visit. The cost is $170. The math is easy. We are going bankrupt. We have no one to help us. We have no unions. We are not allowed to strike. So all we can do is ask you. I have no emergency reserve. I used that up last year. If I get sick, I will lose my house. My kid won't go to college, and about 2,000 people won't have medical care because I will go out of business if you do not act. Only you, the legislature, can change this. This is a dire emergency, about 10 years overdue. Please support the doubling of Medicaid reimbursement for primary care physicians, or we will go out of business. It's that simple. I am representative of about 500 small practices. This will improve the health care of approximately 1 million Hawaii residents statewide. There is money in the system. Please, let's allocate it correctly. Thank you. I also have some written testimony that I stand by. Thank you.
Okay, thank you very much. Anyone else wishing to testify on this measure? Please come forward.
Aloha, Chair, members of the committee, Gina Moore-Peterson, MedQuest Administrator. We stand in support of this measure. Thank you very much. Available for any questions.
Okay, thank you. Anyone else, please?
Aloha, Chair Yamashita, Vice Chair Kitagawa, distinguished representatives. Thank you for the opportunity to be here today. I am Joseph P. Mayer Jr., DDS. I have 40 years of experience as a general dentist in private practice. Currently, I volunteer at the Aloha Medical Mission, and I run an extraction clinic 2 Saturdays a month at the Kahuku Medical Center. Like the others before me, I strongly endorse the additional subsidy for private practice dental Medicaid beneficiaries that you are all well aware that 1, Medicaid is only available to the very needy. 2, the lack of access to care for the last 13 years for the 70,000 Native Hawaiian and Pacific Islanders and the remaining 280,000 beneficiaries in the state. 3, the limited number of patients treated by federally qualified health centers. 4, you have repeatedly heard of the $38 million in annual ER hospital expenses for treating dental emergencies. 5, the effects of poor oral health causing systemic diseases, the cost savings of early intervention. 7, the lack of capacity due to providers not willing to participate in Medicaid. And 8, the meager MedQuest reimbursement fees are part of the reason providers don't participate. I want to point out that the federally qualified health centers receive grants of several hundreds of thousands of dollars annually to treat dental Medicaid patients. Additionally, HHS supplements dental Medicaid fees to other safety net organizations with a prospective payment system with rates from $183 to $509 per encounter for these institutions. Neither of these are available to the private practice dentist. Therefore, the playing field for access to dental care is not level. Providing access to dental care is a socially responsibility that you obviously take seriously, which is why you're conducting this hearing. I have full faith in your decision to balance the need with the resources available. Mahalo for your time and attention. I'm sorry that I didn't get to submit this in writing.
Okay, thank you. Okay, thank you. Anyone else wishing to testify? Okay, seeing none, members' questions. Representative Ward.
Thank you, Chair. Esther Smith, are you still on Zoom? I think I had the
Not
right
present.
name. Okay. Okay, I guess Hilton, what dollar amount should be in there to make what otherwise? I was going to ask her if she made up that term, or did you ever hear of this thing called physician's grief or physician's despair? Or did she make that up? That was the
No,
question.
I think that's it's a term that a number of physicians have used. Yeah, physician
Is it
despair.
clinical or is it just a?
No, I think it's a description of where a number of physicians are at, unfortunately. But in terms of the dollar amount, and we very much appreciate the collaboration with the Department of Human Services and MedQuest Administrator, Gina Moore-Peterson. They did the analysis, and what they determined is that a $30 million in state funds each year would draw down approximately $33 million in federal funds for a total of about $73 million. And that $73 million would close a gap between Medicaid and Medicare reimbursement for professional services. Now, some professional services, because of the ACA, the state is already funding some professional services at 100% of Medicare, which is getting technical, but specifically emergency E&M codes, emergency evaluation management codes for primary care physicians. This would, so we're already funding that as a state, and we're very appreciative of that. What this measure would do would take all of the other codes that primary care physicians use and that all specialists use and take them up to 100% of Medicare. Now, we're not saying that this bill is going to solve all of these access issues, but it is a critical foundational step in terms of closing disparities and improving access across the state of Hawaii. This impacts Oahu, Kauai, all of our counties, all of our communities, and would have a material impact on our ability to improve access for Medicaid recipients in the state of Hawaii.
And keep some of the 750 from getting even larger in its number of
Yeah, absolutely. One of the reasons that we have so many people showing up in our emergency rooms is because they cannot get access to primary care. And if they do show up in our emergency rooms, the cost, even for a routine visit in an emergency room, even if they're on Medicaid, is 3, 4, 5 times higher than what we pay in the physician office. So you're not only are you paying so much more for an emergency room visit, Medicaid or MedQuest is paying so much more for an emergency room visit. Quite often the problem is that because they have not been able to get access to a primary care physician, their condition worsens and they show up at an emergency room much sicker because they did not take care of the problem initially for themselves, their kids, and then they may end up being, not only do they have the emergency room visit, they may end up being admitted to hospital, which costs even more again.
So this one would definitely help.
This would have, we could bring in 100 doctors, and unfortunately or unfortunately, they're all working, taking care of the patients, which is why there's not a lot more physicians here. But this, every single physician we have talked to across this state is supportive of this measure, believes it will have a material impact again on 2 things. One, improving access for Medicaid recipients, and in terms of strengthening our healthcare workforce, because it reimburses these physicians, as you've heard, at a higher rate for Medicaid.
And you're doing all you can do as their cheerleader in the legislature, right?
I am representing my members to the best of our ability.
Okay. Thank you for your testimony.
Thank you.
Thank you, Chair.
Okay, thank you. Yeah, Representative Morikawa.
Thank you. I'm not sure you can answer this, but can Medicaid go above 100%?
I'm so glad you asked that question. We've been doing some research as we've been having this bill move through, and we have found several other states that do pay above Medicare. They do have to go through a process. Of course, you have to get permission from CMS, the Centers for Medicare and Medicaid Services. But we have found examples of some states that have gone above 100% for professional services, for physician services.
Oh, thank you.
Mm-hmm.
Okay, thank you. Any further questions? Okay, we're going to move on to the next bill, Senate Bill 1592, SD2, relating to Senior Medicare Patrol Program. First is Department of Health, Office on Aging.
Good afternoon, Chair, Vice Chair. Thank you, committee, for this opportunity. I am here for Caroline Karirao, our director. My name is Jeffrey Woodland. We stand on our written testimony as well as being here to answer any questions that you have. I would like to point out that 2 things. We did add some graphs to our testimony to help show a little bit of disparity that we have. Number 1, the little checkerboard graph is what our actual program or our mission, which is SMP, is tasked to oversee. All the rest of it is what we do with our extra time. So as you can see, there's quite a lot of disparity there. I can also point out too that we took 2, one of my coworkers went through all of our other programs in the country, and we found 2 of the most closely staffed states that have similar staffing. And then we also pointed out what their Medicare beneficiaries actually are, and you can see great disparity as well. It looks like we 2 times or 3 times more recipients in our state than what we cover. So that would be our testimony for Caroline, and I can say that I have to also add that EOA supports this intent to provide, but that it does not reduce or replace the priorities of our administration. I'm going to get in trouble for what I'm about to do. I can also testify as one of the 2 temporary full-time staff. I'm also here to answer questions for you if you have any questions for me in that capacity. Thank you.
Okay, thank you. AARP.
Aloha, Chair Yamashita, and members of the Finance Committee. I'm Kayla E. Lopez, State Director for ARP Hawaii. We stand in strong support of this measure. If any, well, no, most of you look too young to have gotten it. But when you get the Medicare booklet in the mail, it's about this thick. And even though our kupuna love written materials, you get that thing and there's just no way you're gonna at least sit down in one evening and go through it. The benefit of having a program like this is that folks can talk to someone who can help walk them through the very complex process of determining which part A, B, C, D that you want to go through and what that's going to look like. And even once you've signed up, by the way, every year you have to look at it. So it's not a one-time thing. It's something that you actually need assistance, and the team and the volunteers are just fabulous. They do wonderful outreach. We've seen the benefit of that, and just really support it and hope you'll provide the resources. And I don't report to Caroline, so I say fund it no matter what. Thank you.
Okay, is there anyone else wishing to testify on this measure? Okay, seeing none, members' questions? Okay, seeing none, we're gonna move on to the next bill, Senate Bill 729 SD1 HD2, relating to board members. First up is Real Estate Commission. Okay, thank you very much. Next is Hui Oiaoi.
Aloha, Chair, Vice Chair, members of the committee. I'm Lila Moore of Hui Oiaio. I stand on my written testimony in support with comments. Many condo owners complain about their directors and boards, and one thing stands out. Many directors have never heard of 514B and have never read their association's governing documents. This allegation appears to be substantiated by a review of the Condominium Education Trust Fund subsidized mediation as documented in the Hawaii Condo Bulletin during the period from March 2016 to December 2022, which reveals that nearly 4 out of every 5 mediation cases were originated by owners against their associations for disputes about alleged misfeasance, misinterpretations, or ignorance of their association's governing rules and laws, and non-feasance, including the board's failure to properly plan for necessary repairs and renovation, which then brings about sudden and unwieldy assessments and/or increases in association fees. These disputes have the unfortunate consequence of increasing D&O insurance coverages, costs for associations, and filling the overloaded court system with condo association disputes. Mahalo for the opportunity to testify.
Okay, thank you. Okay, next is Paul A. Ireland. Koftina. Not present. Okay, next is Greg Misakian. Not present. Anyone else wishing to testify on this measure? Okay, seeing none, members' questions. Okay, seeing none. Oh, Bert, please. Representative Kobayashi.
Just a comment. I think that the title of the bill might not fit the Part 1, asking for a sunrise review. So a severability clause would be real important.
Okay. Good point. Okay, anyone else wishing to testify on this measure? I mean, any more further questions? Sorry. Okay, okay, we're going to be moving on to the next bill, Senate Bill 393 SD1 HD2, relating to landlord tenant code. First up is HPHA.
Aloha, Chair, Vice Chair, members of the committee. HPH extends its support.
Okay, thank you. Next is Catholic Charities Hawaii.
Chair, Vice Chair, and members of the committee, I'm Betty Lou Larson, representing Catholic Charities Hawaii. We just want to point out that we are asking for an increase in the funding to cover administration, outreach, and navigation services. We feel it's so important to not just solve the immediate problem, but give the families a chance for financial literacy and other things that will be stable into the future. During the pandemic, we couldn't do it. So many people, so much money, it just went out. But now we really see a need at Catholic Charities to work on this stabilization. And this gives us a chance with people who are facing eviction to really work on this for a couple months while they're receiving some rental relief so that they won't get to this point in the future. It helps the landlord and the tenants immediately, but this would help them in the long term. So thank you very much for hearing this bill.
Thank you very much. Next up, we have Hawaii Appleseed Center for Law and Economic Justice.
We'll stand on our written testimony and support it.
Thank you very much. Anyone else wishing to testify on this measure?
Good afternoon, Chair, Vice Chair, and members of the committee. My name is Lindsay Garcia from the Hawaii Association of Realtors. We sent on our comments appreciating the intent of this measure. We do support the rental relief portion strongly, and we respectfully request November 1st effective date. The Hawaii Association of Realtors creates standard forms on behalf of the entire industry, and November is the next scheduled batch of updates to all of our standard forms, including the rental agreement form. Thank you.
Thank you very much. Anyone else wishing to testify? Okay, seeing none, committee members, questions? Okay, seeing none, we're gonna go on to our next measure, SB 1442. This is relating to Ohana zones. First up to testify, we have the Hawaii Housing Finance and Development Corporation.
Good afternoon, Chair, Vice Chair, we stand on our testimony and support.
Okay, thank you very much. Next up, we have the Governor's Coordinator on Homelessness.
James Koshiba, Governor Coordinator on Homelessness, stand on my written testimony for comments.
Thank you very much. Next up, we have Partners in Care on Zoom. Okay, not present. Is there anyone else wishing to testify on this measure? Okay, seeing none, committee members, questions? Okay, seeing none, moving on to our next bill, SB 898 SD2 HD1 relating to Kupuna Housing. First up to testify, we have Department of Health Executive Office on Aging. No, not here. Okay. Next up, we have HPHA.
Thank you, Vice Chair, Chair, members of the committee, we stand in support. Thank you.
Thank you very much. Next up, we have AARP Hawaii.
Aloha members, I'm Kaylee Lopez, State Director. I didn't want to stand on my testimony because, you know, I know that all of you are really great about generally wanting to support kupuna. And one of the things I think that's real important in this for this particular bill is it specifically relates to the concern about kupuna who are already homeless or are in imminent risk of becoming homeless. And I think as it generally, knowing everyone in our aloha spirit in Hawaii, the last thing we really want to ever see is anyone being homeless, but especially kupuna. So appreciate your support of this bill. Mahalo.
Thank you very much. Next up, Partners in Care. Did they come on to Zoom? Not present. Okay, next up, Catholic Charities Hawaii.
Aloha, Chair and Vice Chair and members of the committee. We strongly support this bill. We see too many sad cases of seniors facing this, long-term renters coming to us who are facing eviction because rents are going up or the lease ends, whatever. But I would like to note that we really support exempting HPHA from the procurement code because we need to start this program as soon as possible. I mean, there are seniors whose health is suffering, and so the soonest we can do it, and however we can best implement this as fast as possible is what we're asking for your support. Thank you very much.
Thank you very much. Is there anyone else wishing to testify on this measure? Yes.
We stand in support of this bill.
Thank you, Hawaii Realtors. Okay, anyone else? Okay, oh, yes.
The Executive Office on Aging stands on it.
Okay, great. Thank you very much. Are there any further testifiers? Seeing none, committee members, any questions? Okay, seeing none, we're going to go on to our next measure, SB 1357 SD1 HD1, relating to affordable housing on Hawaiian homelands. First up to testify, we have the Department of Hawaiian Homelands.
Aloha, Chair, Vice Chair, members of the committee. O Oriana Leao Ko'inoa, DG Charles Nahaza, Government Relations Program Specialist. The department stands on its written testimony in strong support of this measure, and we also concur with the proposed amendments provided by Hawaii County's Office of Housing and Community Development for the benefit of the beneficiaries of the Hawaiian Homes Commission Act in Hawaii County. Mahalo.
Thank you very much. Is there anyone else wishing to testify on this measure? Okay, seeing none, committee members, questions for DHHL? Okay, seeing none, we're going to go on to our next measure, SB 764. This is relating to affordable housing. First up to testify, we have DCCA. Oh, sorry, Director. You just DCCA.
Sorry. We're just trying to time it. Good afternoon, Chair, Vice Chair, members of the committee. Nadine Nando here, Director of Department of Commerce and Consumer Affairs, standing on our written testimony and available for questions, which is written testimony in support of the bill as in its current draft.
Thank you very much. Next up to testify, we have Central Pacific Bank.
Aloha Chair and Vice Chair, I'm Kathy Camp on behalf of Central Pacific Bank in support of SB 764 HD2 and requesting amendments that are outlined in our written testimony. These amendments support the purpose of the bill to permit banks to provide greater support to the affordable rental housing in Hawaii by increasing the state limit applicable to banks to invest in low-income housing tax credit developments from 10 to 15% of the bank's capital and surplus without the approval of the Commissioner of Financial Institutions, and to permit the bank to invest up to 20% of either the Commissioner's approval or notice to the Commissioner. The increase proposed is the lower aggregate LIHTC investment limit that the FDIC's aggregate LIHTC investment limit. We ask for your favorable consideration in passing this bill with our proposed amendments. Thank you so much for the opportunity to testify.
Thank you very much. Next up, we have Catholic Charities Hawaii. Thank you very much. Next up, we have NIAP Hawaii Chapter. Thank you. Next, we have Holomua Collaborative.
Josh Wade for Holomua Collaborative will stand on our testimony and support.
Thank you very much. Next up, we have Title Guarantee of Hawaii. Not present? Okay, anyone else wishing to testify on this measure? Okay, seeing none, committee members, questions? Yes, Representative Ward.
Central Pacific Bank, please. The bill says you can invest up to 15%. What is the average that your bank or the other banks are doing nowadays that needs the bill like this?
Average in what terms? Amount to
Yeah,
participate in?
It says this, you can put your investment up to be 15%.
15% of your risk-based capital. So each bank is different depending on the size of the bank. So right now, that would enable us, going to 15% would enable us to do one more project in LIHTC.
Would that be a subdivision or?
It would be a low-income housing tax credit project. It could vary from a subdivision to could vary from one specific tower, depending on how that project would lay out.
So where are the developers getting their money now?
It's a blend between federal government, from bank financing, as well as the equity that banks provide.
Do local banks have a majority share of the lending?
No, no, just a portion.
What percent will this increase the local skin in the game, if you will?
It's hard to say skin in the game. It's by project specific. So the developers look for banks to provide equity investment in addition to the other types of investment they've received either from their own, from the federal government, or from other government aid organizations. So it helps their capital stack to be able then to borrow against to then fund the development of the project.
So this bill should help the local housing.
Absolutely,
market,
100%.
which we need very, very badly.
100%.
Thank you very much.
Thank you.
Okay, thank you very much. Any additional questions? Yes, Representative Ayu.
For Central Pacific Bank. Well, one, I have concerns that none of the other banks submitted testimony on this. So do you have an idea of what their opinion is on this?
The president of Central Pacific Bank has been working with the other banks, and they are support of the test of the
okay,
bill.
because nationally there's been a lot of bank failures, and I'm concerned that if we give the banks a little bit more leeway with how to invest their money, and I'm not saying this is a risky
Right.
investment or not, but I'm concerned that.
Right. So the banks are regulated by the federal FDIC. Well, our bank is regulated by FDIC. Other banks are regulated by other federal institutions. They come in, and DCCA also regulates us. They come in, look at our loans, look at making sure the safety and soundness and the surety of how we're doing it and what we're investing in. So it's for in Hawaii, we see it very highly regulated, and this amount would be actually less than what we have in other asset classes, if you will, such as investing in hotel or providing loans in hotels or providing loans in consumer reports, in auto refinances and the like.
Okay, so you're saying the banks that had troubles recently were not regulated by the FDIC?
No, so
or
the banks
what?
that had trouble recently had liquidity problems, so their deposits went out the door very quickly. So overnight, Silicon Valley Bank lost billions in deposits, and so that made them upside down in being able to fund things.
Okay.
So it was a very different issue than what this is.
Okay. Okay, thank you.
Okay, thank you very much. Any additional questions? Okay, seeing none, we're going to go to our next measure, SB 865 SD2 HD1 relating to housing. First up to testify is HCDA.
Good afternoon, Chair, Vice Chair, and members of the committee. Craig Nakamoto, Executive Director for Hawaii Community Development Authority. This bill, Senate Bill 865, kind of also known as the Low Homes Bill, we support the intent of it, but we have some comments and suggestions. I think this bill and the bill following this on the agenda presents both a need and an opportunity. The need being the need for more housing, and the opportunity being the opportunity to test leasehold for sale product in the market. And this bill, Aloha Homes Bill, the Senate Bill 865, provides for opportunity to test a leasehold product in the market. Some of the provisions of this bill, I think, are very detailed in terms of eligibility, requirements for development, and I would suggest that these provisions be deleted and allow, if the bill is going to pass, allow HCDA to develop eligibility rules and development requirements, because I think it's going to depend on how developers and the market views this kind of product, and I think we should have the most flexibility to offer the most opportunity for success. Testing out a leasehold for sale product. Thank you for the opportunity to testify.
Thank you very much. Next up to testify is DLNR.
DLNR will stand on its testimony, offer comments, and deal with any questions.
Great. Thank you very much. Is there anyone else here wishing to testify on this measure? Okay, seeing none, committee members, questions? Yes, Representative Ward.
The gentleman who just testified, I forgot which organization.
That
Sorry.
would be me, Representative Ward.
This has a little bit of the Singaporean feel to it. Are you saying if you take out the leasehold and put in fee simple, you would say it's okay, or I missed the point on that?
Sorry. No, it does have that Singaporean feel, because I think the sponsor of this, one of the sponsors of this bill is Senator Chang. In the subject matter, the last subject matter committee, this bill was kind of taken outside of HPHA and put into Hawaii Community Development Authority. So what I'm suggesting, Representative Ward, is to maybe take out the sort of the prescriptive requirements of this bill and say HCDA will develop rules on eligibility and development, just so that we can be more flexible and we can test the market. What will the market bear in terms of this kind of leasehold for sale product? We don't know whether it's going to sell or not, but we believe it will. But we just have to have the flexibility to go out to market that way. It's like testing a product.
But you're saying you can build affordable housing?
I think we can under a leasehold. I think we can, because everything being equal, to build a fee simple unit and to build a leasehold unit, I think the cost will be the same. The difference in a leasehold unit will be the cost of land. So I think if we can use state leasehold land with a lower rental structure but fixed sort of step ups at times, I think we can build it. But it's gonna depend on the bank's willingness to lend on these kind of, for these kind of units. It's also gonna depend on what the requirements are for eligibility. So rather than be prescriptive, I think it's better to be somewhat flexible so we can test what works.
How many units short are we now? Housing units?
I don't know, I heard different numbers.
I mean, it sounds like you got a big job ahead of you. It's probably 50 to 60,000 for the latest that I've heard.
We can't build all of that at one time. I think the capacity to build that many units is not there. But I think what I would suggest is it takes maybe, this is just another tool in building more housing. Is it the only tool? It's not. And I think we just have to build whatever we try to build whatever we can, and this is a way to test it, a leasehold for sale product.
Okay, thank you for your
Thank you,
testimony.
Representative Ford.
Okay, thank you very much. Any additional questions? Representative Ayu.
Yeah, I'm looking at your testimony. What provisions of the bill exactly are you saying is too prescriptive on?
I think, so sections, for example, section C and section D. This starts on page 8, line 1. That's section C of the bill, 206E-C. And then section D of the bill starts on page 13, line 17. I'm not saying that any of those standards could be applicable. I think I would prefer that we have some flexibility in that. For example, one of the development standards requires that we follow Chapter 343, which is the EIS provisions, but affordable housing is sort of exempt from the EIS provisions. So it's not, in sort of the quest to build more affordable housing, I think we want to take advantage of those exceptions. Hope I answered your question, Representative Ayu.
Well, I'm looking at it. I don't see anything egregious, I guess is the question I'm looking for. Like, we're making it that the public would have, no one would be interested in it based on these conditions, but if that's what your concern is, then.
Yeah, my testimony was not intended to say these are egregious. My testimony was just saying that, if we're going to test a product out in a market, give us some latitude to develop or work with developers and others and come up with those standards and requirements rather than it being prescriptive. Now, if that's not the intent of the bill's sponsor, then it's not. But I'm not saying it's egregious.
Okay.
Far from it.
Okay.
Representative Lee.
Thank you.
Thank you.
Thank you.
Thank you very much. Yes, Representative
hi.
Kobayashi.
I think we've been down this road before. The 99-year lease, according to one other testifier, permanently alienates land from other possible users. Is 99 years sensible to you?
I think 99 years is sensible. The following bill that's on the agenda is actually the administration's bill, and it's to give HCDs a 99-year lease, right, versus 65 for non-ceded lands to build affordable housing. From a bank, from a marketability standpoint, from a financing standpoint, I think 99 years is feasible. I think it's true, Representative, that at the end of the 99-year lease, you're going to face sort of renewal issues. What's going to happen with the existing owners? And frankly, that's something I think we have to work out. Those are the details we need to work out.
But in this case, the 99-year lease goes to a single person.
So what would happen is, the way I would envision it happening, Representative, is that we would RFP for a developer to build a 99-year leasehold condominium, let's say, and we have a ground lease for that. The state has a ground lease, or HCDA, and we establish reasonable terms on the ground lease. Not these wild reopeners, but sort of these step-ups, sort of a known rent and it steps up at certain times, and then a developer builds a condominium on it, and then they sell leasehold units, like in the 70s with leasehold units. Except you're not going to have the wild reopeners that sometimes was plagued some of the older leases.
No, but I think that what this then creates is a situation of people who have a 99-year lease, and then a lot of others who have 0. And one person has, shall we say, security for 99 years. You know, it's a matter of equity between those who have and those who do not.
I'm sorry, Representative, I'm not understanding the question.
Oh, that's all right then.
Okay, okay. What we try to do is create a leasehold for sale product instead of a fee product, and under some kind of over a ground lease that would be reasonable. Thank you.
Okay, thank you very much. Any other questions? Okay, seeing none, we're going to go to our next bill, SB 1286 SD1 HD2. This is relating to the Hawaii Community Development Authority. First up to testify is DBED.
Hi, Chris Sariyasu with DBID, Chair, Vice Chair, members of the committee. We stand in support on it. So,
Thank you very much. Next is HCDA.
Thank you, Chair. Vice Chair Craig Nakamoto, Executive Director of the HCDA. We support this bill and set on our written testimony. Support. Thank you.
Thank you very much. Anyone else wishing to testify on this measure? Okay, seeing none, committee members, questions on this bill? Okay, seeing none, we're going to go to our last bill on the agenda, SB 975 SD2 HD2. This is relating to health. First up to testify is the Attorney General's office.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Rich Stacy. I'm a Deputy Attorney General with the Tobacco Enforcement Unit for the Attorney Generals. Our department is in strong support of this bill, which would finally allow for electronic smoking device and e-liquids to be taxed appropriately like other tobacco products. Our Tobacco Enforcement Unit is also tasked with the Electronic Smoking Device Retail Registration Unit. In a recent count, we had 695 electronic smoking device retailers registered with us. 90% of those also had to register with Department of Taxation for their separate tobacco retail permit. Retailers have to do it with dough tax electronically. With us, it's by paper. It often causes a lot of confusion, and it's basically two things very similar happening at different agencies and very inefficient. By combining the regulation of electronic smoking devices and e-liquids with dough taxes, retail tobacco permit, and licensing, would make our unit, our separate unit of being a vape retailer unit, no longer necessary. It would be more efficient. And I thank you and available for questions.
Thank you very much. Next up to testify, we have the Department of Health.
Good afternoon, Vice Chair and Chair, members of the committee. I'm Lola Irvin, representing Dr. Kenneth Fink for the Department of Health. And I thank the committee very much for scheduling SB 975. The director has a vision that Hawaii residents have a fair and just opportunity to achieve optimal health and well-being. And within that then is that our keiki would be able to then reach that optimal health and well-being, to learn and to grow and to have that healthy future and present. And so we thank you so much for hearing SB 975. We're in strong support because currently we don't have any fences around these products and the promotion of the products. And increasing the price will also then increase some protections around the keiki by making it more difficult to purchase. And we do like this version in that it has the online shipping and handling restriction so that only people who are licensed and permitted could do that. Our children are very smart. They know how to go online and buy these things online. And also then we know that they sell to their peers. And so this would provide some of that fencing that we need between the products being promoted online and our children being able to use then online shipping and handling as a way to have it. The other recommendation we have is that it would be taxed as other tobacco products. And that would then, in terms of the implementation, from a public health perspective, we're really interested in this being implemented sooner and the revenue coming in sooner into general funds. And so we do recommend that it not be taxed separately, but that it be taxed together under tobacco products. So thank you so much for the opportunity to provide testimony.
Thank you very much. Next up is the Department of Taxation.
Good afternoon, Chair and Vice Chair and members of the committee. Gary Suganuma, Director of Taxation. The department stands on its written testimony offering comments. Thank you.
Thank you very much. Next up, we have the University of Hawaii Student Health Advisory Council on Zoom. Not present. Okay. Next up, we have the Hawaii Public Health Institute.
Good afternoon, Chair, Vice Chair, members of the committee. Peggy Mirza with the Public Health Institute. Thank you so much for putting the bill on the agenda. We support comprehensive tobacco policies, and SB 975 is such a measure. In fact, it's the only measure left that can address these issues. It addresses the online sale of e-cigarettes to minors because no tobacco product should be easily accessible to youth via online purchase. E-cigarettes, a tobacco product, would finally be incorporated into the definition of tobacco products in Chapter 245, which presents the opportunity to tax them the same as other tobacco products. By treating all tobacco products with tax parity, implementation is streamlined and the administrative burden is lessened. By incorporating e-cigarettes into this existing structure, the Department of Taxation will be able to more quickly impose the tax. If it remains in a separate subsection, it means it will take about an additional 1.5 years to implement the policy. Increasing price by increasing taxes is a CDC best practice to stop youth initiation and to decrease adult use. The FDA has recognized these products as tobacco products since 2016, and that aligns with public opinion. We did a poll, Ward Research ran a poll for us in December of 2022, and 91% of Hawaii registered voters stated that e-cigarettes should be treated and regulated as tobacco products. Thank you.
Thank you very much. Next up, we have the American Lung Association of Hawaii on Zoom. Not present. Next, we have HSTA.
Aloha Chair, members of the committee, Laverne Moore speaking on behalf of Osa Tui, President of the Hawaii State Teachers Association. All of you were visited by the HST Government Relations Committee people. We represent the 12 chapters from the state of Hawaii, and our top bill was House Bill 975. We gave you the data on what is going on, and they told you their stories of the epidemic that's going on in our public schools starting from kindergarten. We lost our important bill on vaping, not vaping, but on eliminating flavored products, e-cigarettes. We lost that bill. This is the only bill that's surviving. Please pass this bill. We teachers are truly having problems in the school. Our students cannot learn if they're addicted to nicotine. So you got visited by our teachers personally, and they told their stories. Thank you very much for the opportunity to testify.
Thank you very much. Next up, we have Retail Merchants of Hawaii on Zoom. Not present. Okay, next up, we have the Hawaii State Youth Commission on Zoom.
Aloha, Chair Yamashita, Vice Chair Kitagawa, and members of the Committee on Finance. My name is Hanalei, and I'm a member of the Hawaii State Youth Commission, which was first created through Act 106 in 2018 to advise the governor and legislator on the effects of legislative policies, needs, assessments, priorities, programs, and budgets concerning the youth of the state. As representatives of the youth of Hawaii, the Commission is committed to promoting inclusivity, opportunity, and progress in Hawaii, and this includes the health of Hawaii's youth. That is why the Commission strongly supports this measure, because its efforts to address the unlawful shipment of e-cigarettes, tax them as tobacco products, and license and permit sellers is crucial to decreasing tobacco use among youth, thereby improving the health and lives of both Hawaii's youth and the communities that they live in. The Hawaii State Youth Commission's Public Health Legislative Committee is in strong support of SB 975 SD2 HD2. However, we respectfully urge the committee to amend the language of the bill back to the language taxing e-cigarettes at 70% of the wholesale price found in SD2. This is because a 70% taxation will ensure that e-cigarettes are taxed the same as other tobacco products, which in other states have helped to decrease underage tobacco use and the negative health effects of such products on youth and keiki. Furthermore, regulating online sales will prevent youth from accessing e-cigarettes, decreasing incentive for youth addiction. By taking these actions starting this year, we can tackle the youth vaping epidemic and prevent more youths from being lost to addiction and disease. Therefore, the Hawaii State Youth Commission strongly urges the committee to pass and amend SB 975 SD2 HD2 so that we can prevent the dangers of tobacco from affecting any more keiki. Mahalo for the opportunity to testify.
Thank you very much. Next up, we have Americans for Tax Reform on Zoom. Not present. Okay, next up, we have the American Heart Association.
Good afternoon, Chair, Vice Chair, members of the committee. I'm Don Weissman with American Heart Association, Hawaii Division. We are offering comments on this bill. The only thing keeping us from supporting it is the fact that the amount of the tax is blanked out at this point, but we strongly support establishing parity with other tobacco products, as you've heard from others. One of the reasons why it's really important to have parity is that because kids are super price sensitive, and if you have one product that's cheaper than others, the tobacco industry will focus its marketing on those cheaper products and just move those kids to the other products. And so it's really important that we establish parity. We know that the cigarette tax has had a great impact on reducing youth use in our state. By establishing parity, we can use this in the same way to address vaping issue in our state. So parity is a key. The date of effect that the bill would become effective is very important. Right now it has a defective date, but you know, we've been trying to get this passed for over 5 years, probably closer to 10. That's that's a generation that we're losing to addiction, and we need to stop it as soon as possible. E-cigarettes are, you know, there's 10-year-old data which would at the time suggested that e-cigarettes could be a safer alternative. Research is catching up with that now, and more recent research that the Heart Association has done, and we're investing a lot of money into research on this, has shown that e-cigarettes are at least as dangerous as regular cigarettes to the cardiovascular system, and cardiovascular disease remains our state's leading cause of death and major disability, heart disease and stroke. And so we're finding now the e-cigarettes cause the same type of problems to the cardiovascular system. So anyone who tells you that they're safe, they're not safe. And most adults who use e-cigarettes are also dual using regular cigarettes when they can't use their e-cigarettes. So it's very important that we amend this bill to restore the tax to a rate that would establish parity. We set an effective date so that it won't drag on another year without addressing this issue. And with that, I'm here for any questions.
Thank you very much. Next up to testify, we have Campaign for Tobacco-Free Kids on Zoom.
Aloha, Chair, Vice Chair, members of the committee. Liza Ryan Gale with Campaign for Tobacco-Free Kids here in Hawaii. We are offering comments as well, and we just want to echo those of the Hawaii Public Health Institute and American Heart Association that we'd like to see the bill return to parity, both for expediency and because our keiki are very price sensitive. Just as a reminder, for every one adult that switches from combustible cigarettes to e-cigarettes, we have 81 children that would not have started a nicotine addiction start one. So this is something that we need to do. You know, you've heard everything already from my colleagues on this front. It's time that we at least take this step on regulation and taxation. We also need to take flavors off of the market. This is a part of a comprehensive approach. Just as a reminder, when we were working on reducing the number of folks that impacted and using combustible cigarettes, it wasn't one policy that changed that and reduced smoking across the board. It was a number of policies. So we see taxation as one critical way to approach this, and we hope that the legislature will also move on other issues. Regulation is the first step in that process. Mahalo for your time.
Thank you very much. Next, we have Aloha Care.
Aloha Care stands limits for testimony and support. Thank you so much.
Thank you very much. Next up, we have Cigar Association of America. Not present? Okay. Next, we have HMSA. Thank you very much. Next, we have Tax Foundation of Hawaii on Zoom. Not present. Okay. Next, we have individual Richard Marianos on Zoom. Not present. Okay. Next, we have individual Anthony Carruthers on Zoom. Not present. Okay, that's all we have who indicated they'd like to testify. Is there anyone else here wanting to testify on this measure? Okay, seeing none, we will go to questions. Oh, sure, go ahead.
Aloha, Chair, Vice Chair, and the Fin Committee. Angela Melody Young testifying on behalf of CARES. The Keiki Caucus was created in 1994 by Suzanne Chun Oakland and Dennis Arakaki, and the Keiki Caucus proposes, drafts, and supports and implements policy changes to improve the lives of Hawaii's keikis. In October 2022, the Keiki Caucus held its annual Hawaii Children and Youth Summit to bring children together across the state to help prioritize issues and strategize solutions that required statutory changes to be implemented at the county, state, and federal level. And it declared that addressing vapes is one of the biggest priorities for the legislative season of 2023. And during the process, the students stated that their focus should be to create middle school and high school programs with peer-to-peer support, therapy and counseling to emphasize the consequences of smoking while increasing awareness about health education. So thank you for the opportunity to testify.
Thank you very much. Anyone else wanting to testify? Okay, seeing none, now we'll go to questions. Yes, Representative Ayu.
I have some questions. The Department of Health first. And maybe this is not directed at you, but I'm looking at the unlawful shipment of tobacco products. Can you explain the enforcement mechanism and how you track people who unlawfully ship in violation of this provision?
Representative Ayu, that is an excellent question, and I have an excellent colleague who can reply to your question, and he's with the Attorney General's office for the Tobacco Enforcement Unit. May I give the mic over to him?
Yeah, but please stay close because I have some other questions.
Okay, thank you.
Well, first of all, I'd like to point out that that provision probably came from Department of Health.
I assume so, but
so if it's in, basically Chapter 245 includes some criminal punishment, criminal cases. My unit does enforce Chapter 245 for those sort of things. Typically, it might come in as a, we might get a report from a citizen, we might get a report through Department of Health. We do have investigators. It is a new offense, so I'm not sure yet, but if it's an offense and you guys pass it into law, then we will be enforcing it.
I mean, it seems to me that the testimony today was that this is gonna save our kids, and I'm trying to figure out how we're checking the mail and making sure that people aren't shipping. How is that? How is this actually reducing the amount of vape products that are in our schools?
Well, as far as enforcing, we have things called the PACT Act that people shipping into Hawaii have to file. So we get that, Department of Taxation gets that. So it's not like we're gonna be going through everyone's luggage or the postage, but it will come up and we probably will make cases. I think a lot of this bill had to do with taxing finally, and that would be a big part of what would reduce vape. But having the criminal component is a valuable component.
Okay. And then as far as the shipping is concerned, is it unlawful now to ship vape products to a minor?
Yeah, minors are not allowed to have vape products, yes.
So they're not allowed to go online and buy vape products?
I'm sure it happens, but in 7, 12, 1258, they're not allowed to have tobacco products, including vape.
So I'm kind of confused with this amendment and the law and how it's actually stopping kids from getting vape products.
Well, I'm not sure the purpose of the law, I didn't write it, but I would guess that it would allow enforcement for those that are smuggling into kids, that aren't being taxed. There's various,
I'm not talking
an
about the
expert.
tax component, I'm talking
Okay.
about the misdemeanor and the Class C felony for shipping products.
Okay.
It's already illegal to ship vape products to minors, right?
It's illegal for minors to have it. It's illegal to sell it to a minor, but that's in the criminal code, not in the tax code. This is in 245. So, I mean, it
Okay.
is different than what exists now. It would be another tool, but I can't say I'm an expert at it because we haven't done it yet, but we would intend to enforce it.
Okay. Do you have a different answer than what
No,
they
I have a
saw?
supplemental
Okay,
answer. I
go
would
for it.
never counter what the Attorney
Okay.
General's office says. But you ask really good questions because actually a similar parallel law exists for cigarettes, combustible cigarettes. And so it is illegal to ship and handle cigarettes over the mail. And what we do know is that, and if you can try it too, you can go on the online sites, and if you put in e-cigarette pods, cartridges, you will see a lot of products, and they will ask for your age, and I can say yes. I mean, I'm definitely over 18, but it's easy to get past that. Thank you. It's easy to get past that and to get to the point of purchasing. And
So does this close that loophole? Or,
it will actually then make, as our deputy AG said, he has not gotten to the point of enforcement, but there will be actually then criminal accountability that would be provided in state statute.
Okay, so if a child goes online and says, I'm over 21 and they order the product, we're going to criminalize now the shipper.
Not the shipper, the person that's the entity that is selling.
The entity that's selling to the minor, even though they don't have any information about who's ordering online or not.
Well, and so the other states that have these, and it is not an uncommon law at the state level, so the other states that have it have notified of the state regulation. And so we do know that other states, especially when we had the EVALI, the lung injury that was due to e-cigarette use, a lot of states put in executive orders to notify online stores that this was not being allowed. And so it did stop it, and so other states then moved forward with actually then putting it into their statutes. And they have reduced e-cigarette use.
Okay, okay, thank you.
Thank
And then
you.
for American Lung Association, is that American Heart Association? There's been a lot of testimony on price parity. I'm just trying to understand because in my experience, the vape products are already more expensive than a pack of cigarettes. So can you explain what we're talking about exactly
No,
for
they're
price
not.
parity?
If you pay attention to the media, they're advertising starter kits for as low as 99 cents. Pack of cigarettes, the tax alone is $3.20.
Okay.
So that tax is what makes the difference in the cost. So what we want to do is tax these to bring them to that same level of cost to kids. It also helps adults who are trying to quit. It makes it more, gives them more incentive to quit. So, but the main focus of this is really trying to address the kids' problem, but it has a dual purpose.
Okay, so your testimony is that there are sellers out there that can sell these products at 99 cents, as low as 99 cents.
There's ads on the radio
Okay.
advertising that, back
Okay.
to school sales, so.
And then I guess my last question is, there's been a lot of testimony about this, but it doesn't actually seem like it's addressing kids getting the products and it being in schools. Do you have a thought about a direct way to reduce kids from getting these products? This seems like an indirect way, that's why.
I think, there's no perfect answer to anything. We've got a lot of laws in place. We've got laws in place on drunk driving. There's still people that do it. You're going to reduce it, though. This law would help to make a major impact on reducing the amount of kids who are getting access to these products. And that's the goal. It's going to take a comprehensive effort, as was said earlier. The flavors is another key issue that needs to be addressed because that's another attraction to the kids. So it's going to take comprehensive. This is two pieces from our perspective, the licensing and the tax, that are key to beginning to address this issue in our state.
Okay, thank you, thank you.
Thank you very much. Any additional questions on this measure? Okay, seeing none, we're gonna go right into decision making.
Okay, thank you very much, members. We're gonna start with Senate Bill 239 SD2 HD2 relating to early learning accreditation. Recommendation is that we blank out the FTE and tech. Any discussion? Vice Chair for the vote.
Recommendation of the chairs to pass SB 239 SD2 HD2 with amendments. Chair and Vice Chair vote aye. Representative Ayu.
Aye.
Representative Chun.
Aye.
Representative Cochran.
Aye.
Representative Garrett.
Aye.
Representative Kahaloa.
Aye.
Representative Kila.
Aye.
Representative Kobayashi.
Aye.
Representative Lamosao. Representative Morikawa.
Aye.
Representative Nishimoto is excused. Representative Poi Poi.
Aye.
Representative Takenouchi.
Aye.
Representative Alcos.
Aye.
Representative Ward is excused. Chair, your recommendation is adopted.
Okay, thank you very much, members. Moving on to Senate Bill 295 SD2 HD1. We're gonna move this out as an HD2. Defecting the effective date to 6/30/3000 and tech. Any discussion? Vice Chair.
Recommendation of the chairs to pass SB 295 SD2 HD1 with amendments noting the excused absences of Representatives Nishimoto and Ward, who will be noted excused for the rest of this agenda. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Moving to Senate Bill 404 SD2 HD1. We're gonna move it out as an HD2. Defecting the effective date to 6/30/3000 and tech. Any discussion? Vice Chair.
Recommendation of the chairs to pass SB 404 SD2 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Moving on to Senate Bill 397 SD2 HD1 as is. Discussion. Vice Chair.
Recommendation of the chairs to pass SB 397 SD2 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, Senate Bill 1592 SD2. Moving it out as an HD1, blanking out the position, redefecting the defective date, and tech. Any discussion? Vice Chair.
Recommendation of the chairs to pass SB 1592 SD2 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Yeah, thank you very much. And, Representative Kobayashi, we can address that in subject matter, your severability questions. Okay, moving on to the next bill, Senate Bill 393 SD1 HD2. We're gonna move this out as an HD3. We're gonna be blanking out the dollar amounts and tech. Any discussion? Vice Chair.
Recommendation of the chairs to pass SB 729 SD1 HD2 with amendments. Oh, no, wait, which one are we on?
This is Senate Bill 393. Oh, I skipped one. I'm sorry. Okay, I skipped one. Okay, we're gonna go back. Senate Bill 729 SD1 HD2. We're gonna move this out as is. Discussion. Vice Chair.
Okay. Recommendation of the chairs to pass SB 729 SD1 HD2 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Now we're gonna move on to Senate Bill 393 SD1 HD2. Moving out as an HD3, blanking out the dollar amounts and tech. Any discussion? Vice Chair.
Recommendation of the chairs to pass SB 393 SD1 HD2 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, Senate Bill 1442 SD2 HD1, moving on to the HD2, blanking out the FTE and tech. Discussion. Vice Chair.
Recommendation of the chairs to pass SB 1442 SD2 HD1 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, SB 898 SD2 HD1 as is. Discussion. Vice Chair.
Recommendation of the chairs to pass SB 898 SD2 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, Senate Bill 1357 SD1 HD1 as is. Discussion. Vice Chair.
Recommendation of the chairs to pass SB 1357 SD1 HD1 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, moving on to Senate Bill 764 SD1 HD2. We're going to be moving this out as an HD3, pretty much with the the recommendations that was provided in testimony. We're going to be deleting the 30-day timeline requirement for the commission to render decision, the bank investment in aggregate amount of 15% of the capital and surplus without prior approval, and then adding also that the 15% can move forward without prior approval, so long as it doesn't exceed 20%, and they have to notify the commission. Any discussion?
Chair.
Yes.
Yeah, so I think in subject matter, there was some discussion about the 30-day approval taking a long time. And that's why we put the 30-day approval in.
Yeah.
And it gave the applicants a little bit more comfort knowing that they were gonna get the.
Understood.
Yeah.
Yeah, this is with prior concurrence from the housing chair.
Okay, got it. Thanks.
Okay.
Thank you, Chair.
Okay, thank you very much. Any further discussion? Okay, Vice Chair.
Recommendation of the chair is to pass SB 764 SD1 HD2 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. Moving on, Senate Bill 865 SD2 HD1 as is. Discussion.
Chair,
Representative Cochran.
yeah, I have a lot of concerns with this particular one, so I'm a no on this one, Chair.
Okay, thank you very much. Any further discussion? Representative Kobayashi.
I'll go no.
Okay, thank you. Any further? Okay, Vice Chair for the vote.
Recommendation of the chair is to pass SB 865 SD2 HD1 as is. Are there any reservations? Noting the no votes of Representatives Cochran and Kobayashi, are there additional no votes? Chair, your recommendation is adopted.
Okay, thank you. Moving on to Senate Bill 1286 SD1 HD2 as is. Discussion. Vice Chair.
Recommendation of the chair is to pass SB 1286 SD1 HD2 as is. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much. We're moving on to Senate Bill 975 SD2 HD2. We're going to be moving this out as an HD3, blanking out all the fees and tech. For the people in the audience, we're just putting everything in place, so that don't be too concerned about that it's blank. We just want to put everything in play. So it'll go to conference, and the House, the lead committee chairs will be in conference to discuss all the details of the bill. So discussion. Vice Chair for the vote.
Recommendation of the chair is to pass SB 975 SD2 HD2 with amendments. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you very much, members. We are adjourned.